Hey guys! In this lesson, we are going to be talking about spina bifida. Spina bifida is a congenital anomaly where the spinal cord or the neural tube has a defect and it didn't form properly. Now, there's actually a spectrum of these neural tube defects, and they vary in terms of severity. The two most common types are anencephaly and myelomeningocele. Anencephaly is the most severe neural tube defect, and this is where both the cerebellum and the cerebrum are missing, and this is actually incompatible with life. The other three types of neural tube defects are depicted in the photo here. So you have spina bifida occulta, a meningocele, and a myelomeningocele. The spina bifida occulta isn't usually visible from the outside. You can see in the photo here, there's a small gap in the spine, but there's no opening on the skin. There may be hair or dark skin covering the area, but other than that, it's not very visible. With a meningocele, there's a larger gap, and there's actually a sac of fluid that protrudes through the skin. With a myelomeningocele, there's actually meninges and nerves protruding into the sac of fluid. So to just help you remember that, just know that myelo means nerves, meningo means membranes, and the cele here refers to that sac that's protruding. So you've got the nerves and the membrane and the herniated area that's protruding. The actual cause of spina bifida is known to be multifactorial, so that just means there are a lot of different things that could be contributing to it. There definitely seems to be a genetic element, but one huge factor that we know of is that lack of folic acid in the mother's diet can contribute to this. So it's recommended that women of a childbearing age actually should take a daily supplement of folic acid, and they should have 0.4 milligrams daily, and this is to help prevent spina bifida from occurring. Spina bifida is usually discovered either during a neonatal ultrasound or at birth during that neonatal assessment. Symptoms are going to vary with each patient depending on what type they have, but if it is a myelomeningocele and the spinal column and the nerves are protruding, the patient is going to have some amount of lower limb paralysis, bowel and bladder dysfunction as well. So it's very important that during our nursing assessment of this newborn that we are looking for those lower limb movements and responses to touch, and then we also need to be monitoring their bowel and bladder function very, very well. So maybe paying attention to their urinary output, are there signs that they have any bladder distension, and they may also have meconium ileus and become constipated, so be on the lookout for all of those different things. Joint deformities are also common with patients with spina bifida. Things that we might see are contractures, hip problems, and club foot. These patients are also at increased risk for having hydrocephalus, so make sure that you're checking daily head circumferences on these babies and that you are looking for signs of increased intracranial pressure. These babies are going to most likely need to go to surgery within 24 to 72 hours of being born. And prior to surgery, our top priority is to protect that protruding sac and try to keep it from getting infected. So we need to cover it with a sterile, moist dressing, and then we need to make sure that pressure isn't put on it. So we're going to make sure the baby stays in a prone position with their hips flexed. And again, this just reduces the strain on that sac. Also keep in mind, because of this protruding part of their body, they are at risk for hypothermia. So they're usually going to be kept in an infant warmer. Now, while I'm saying that, I want to point out that they should never have a rectal temperature done. You should never do rectal temps in newborns anyway, but this is especially true for patients with spina bifida because they are at an increased risk for having rectal anomalies. These babies may need intermittent catheterization if their bladder becomes distended. And remember, kids with spina bifida are a lot more likely to develop latex allergies. We don't totally understand why, but it could just be from repeated exposure. So you need to always double check and make sure that your equipment is latex free. Once that malformation is repaired, our nursing care really shifts to long-term management to help patients cope with the problems that are associated with that spinal cord damage. And again, this is going to vary per patient, but the most common issues that we see are the neurogenic bladder, bowel problems or the neurogenic bowel, and MSK and mobility problems. Both bladder and bowel control issues require really careful planning and developing a routine to prevent problems. For the bladder, you're going to see things like clean intermittent catheterization that's done periodically through the day to empty the bladder, and oxybutynin is given to decrease bladder spasms and help with the amount of urine the bladder can hold. Bowel control is achieved through scheduled bowel evacuations, and this is done according to the child's schedule, and it's really important that we prevent constipation with a healthy diet and fiber and laxatives. Again, paralysis is pretty common in the lower extremities, so a lot of these kids are going to end up having wheelchairs or other mobility devices to help maximize their independence. Your priority nursing concepts are functional ability, mobility, and elimination. Okay, so your key points for this lesson are, first, just knowing that spina bifida is a spinal cord deformity or a neural tube defect. There are a variety of diagnoses that fall under this category that vary in terms of severity, but the two most common are anencephaly and myelomeningocele. Anencephaly is incompatible with life, and myelomeningocele causes the most symptoms because the spinal cord and nerves have protruded out of the spine into that sac. The symptoms that most commonly occur with myelomeningocele are lower limb paralysis and bowel and bladder dysfunction. These babies are going to need surgery within 24 to 48 hours of being born. Prior to surgery, the top priority for our nursing care is applying a sterile and moist dressing over that sac to prevent infection and to make sure that it stays intact. We also need to make sure the baby is positioned on their stomach with their hips flexed to reduce pressure and stress on that area. Our long-term care is focused on bowel and bladder function and then maximizing mobility and independence. Our patient education is super important here because we can help prevent this from happening. Remember, all women of childbearing age should take a folic acid supplement daily to help prevent these spinal cord malformations from occurring. All right, you guys, that's it for our lesson on spina bifida. Make sure you check out all the resources attached to this lesson. Now go out and be your very best self today, and happy nursing.